Welcome to the Power of Care Spotlight. I'm Larry Moliterno with Meridian Community Care, here today with Jim Evans, our Senior Vice President. One of the issues we want to talk about today, Jim, is relapse. I think it's one of the most misunderstood aspects of addiction and the recovery process. And I think it is part of that recovery process, isn't it?
Yeah. Relapse, to some people, they look at it as a failure or return to the addiction, when in reality, it's the end result of not getting it right.
And we don't all get it right the first time, do we, in anything we do?
Probably in most things we do. Ride a bike, we get it right the first time.
Right.
And you learn from those mistakes. And treatment really helps in people understanding the dynamics of relapse and giving people tools to recognize it, because it's really a process, not an event of picking up the drug. There's things that happen long before that, where a person's thinking changes. So we try to warn people that on their anniversaries, 30 days clean, 60, 90 days clean, 6 months, a year, those are high risk times for relapse. People's thinking change. They believe they're doing better than what they really are. They maybe shift their thinking back to old ways of thinking.
Well, and for us, a big part of our job is to really introduce people into the rooms, the 12-step rooms.
Right.
And sometimes, do we have problems where maybe someone thinks that they're doing well and maybe they don't think that they need to be going to as many meetings?
Yeah. Old thinking patterns, they miss the old lifestyle, they see an old friend, different things in their environment trigger old thinking. They believe they're doing better than what they actually are and maybe don't need as many meetings anymore. And yet it's the addiction talking in the back of their head.
Well, what advice can we give for family members? Because I think you think about those family members who find such relief in the fact that the person that they care about is finally doing well in the recovery, and then for those people that relapse hits, really can devastate families again.
Right. Just be aware of those times when somebody's thinking begins to change. If you have a safe enough relationship, give them a heads up, kind of predict those times. For everybody in a family is to practice. There's nothing that's going to make me mad enough, sad enough, or glad enough to get high. There needs to be balance and as much calmness as you can. And family practices, activities at home, we suggest relaxation activities for everyone. Mindfulness, yoga, anything to get centered and calm.
One of the things I like about what we're doing at Meridian now is offering individualized counseling for any family member who just wants to deal with all the issues and the stressors that come with dealing with this issue within your family. And also, of course, Al-anon and supporting the work that Al-anon does.
And I think for family members, too, is to understand when a recovering person does relapse, when they do pick up the drink or drug, the amount of shame and failure that begins to go on inside their mind, and that the reality is if they get to meetings, if they tell somebody, and that's most important, to tell somebody, and as a family member I hear it, I've got to be able to accept that and know that that's a bump in the road in the long haul towards recovery. If I overreact to it or underreact, there's going to be problems, but just realize it happens.
And so we really want to encourage people that relapse does happen for some people,
right.
and that we have to make sure that as family members that you're prepared to handle that you know that how you're going to help work that person through that process and how you're going to react to it is really important part of all this.
Yeah, it's that acceptance and knowledge.
So we also want to offer the fact that if anybody has a family member that they're concerned about, that they want to get more information, they can call us. We can do a free consultation with them here at Meridian Community Care, and we invite anybody who has that kind of concern to give us a call.
Exactly.
Thanks, Jim.
Yeah, thank you, Larry.